Welcome everyone, and thank you for joining today's webinar on open disclosure. My name is Liz Hefren-Webb. I'm the Aged Care Quality and Safety Commissioner, and I'm chairing today's webinar. I would first like to acknowledge the traditional owners of the lands on which we meet today and pay my respects to elders past and present. I extend that acknowledgement and respect to Aboriginal and Torres Strait Islander peoples watching today. I am joining from Ngunnawal and Ngambri country. Today's session will talk about the importance of open disclosure in aged care, including what it is, why it is important, and when it has to be practiced. We've got an excellent lineup of panellists for you today. Treasure Jennings, the Aged Care Complaints Commissioner, David Pezzaniti, Assistant Commissioner Intake and Complaints, Dr. Mandy Callery, our Chief Clinical Advisor, Kyle Sheldrick, Assistant Commissioner, Serious Incident Response Scheme Provider Performance and Insights, and we'll discuss the benefits of open disclosure and how it supports providers to have genuine partnership with older people that respects and enlivens their rights. Before we get into the main part of today's session, I'd just do a bit of housekeeping. You can send your questions through at any time. Just use the live Q&A tab, which should be visible on your screen. Today's webinar will be recorded and published on our website in the next couple of days. Everyone who registered for today's session will be sent a link to the recording as soon as it's available, so you can watch it again or share it with colleagues, friends or family members. Now it's my great pleasure to invite Treasure Jennings, our Complaints Commissioner, to speak about open disclosure.
Thanks, Liz. Hello, everyone. Thanks for joining us today. I'm coming to you from Melbourne, which is the lands of the Wurundjeri people of the Kulin Nation. It's a great privilege today to speak to you about open disclosure, which is a fundamental practice when delivering safe and quality aged care. So, to begin with, open disclosure is the open, honest and empathetic conversation that an aged care provider has with older people when something goes wrong with their care and services. It needs to be practiced in all circumstances where an incident or possible incident has happened, or a complaint has been made. The older person's family, kin, carers, supporters and authorised decision makers can be involved too, if that's what the older person would like. This means that when the provider receives a complaint about an older person's care or identifies an incident, they need to practice open disclosure so they can resolve the matter with the older person. Thanks. In moments where the care doesn't go according to plan, open disclosure provides the opportunity to respond in a way that upholds the rights of older persons and achieves restorative outcomes. It opens up a dialogue for the provider, worker and older person to speak about what happened and why, how it impacted the older person, and what can be done to resolve it or prevent it from happening again. Open disclosure puts older people at the centre of their care and helps them to be in control of what happens to them. This is consistent with the Statement of Rights. An older person has the right to ask and be provided with records and information about their rights and the funded aged care services they access, including the cost of those services. To be informed in a way that they understand about the funded aged care services they access, and to express opinions about that service and have those opinions heard. They also have the right to open communication and support from providers when issues arise in the delivery of funded aged care services. As the Aged Care Commissioner, Liz is the Aged Care Commissioner. As the Aged Care Complaints Commissioner, I'm very committed to working with providers and workers to ensure open disclosure is always practiced when it needs to be practiced. So we together uphold the rights of older people and protect their safety, health, well-being and quality of life across all stages of their aged care journey. I acknowledge that open disclosure is not always easy because speaking openly and honestly when things have gone wrong is challenging, especially when emotions are running high. However, I believe it's achievable and necessary. It's an opportunity to restore the older person's trust and confidence in your care, and it's the right thing to do. And by the end of the webinar, I hope you'll leave with something useful that you can take away. In the coming months, we will release educational resources that are useful and practical. Some of the materials will be made available in different languages to support diversity in our aged care workforce and ensure providers and workers are equipped to meet the preferences of culturally and linguistically diverse communities and First Nations people when you practice open disclosure. We'll also look for opportunities to engage and consult with the sector to understand how we can best empower open disclosure practices and answer any questions you may have. For example, we're presently working with a research provider to understand older people's and aged care workers' experiences with open disclosure. For the remainder of the session, I'm going to invite my colleagues to join me for a deep dive into open disclosure. We're going to cover what it is, what it involves, what a provider's obligations are, and step through some scenarios of when open disclosure must be practiced. Very first up, I would like to invite David Pezzaniti to speak about open disclosure essentials. As Liz mentioned, David is the Assistant Commissioner for Intake and Complaints. Welcome, David.
Thank you, Treasure. Hello, everyone. I'm coming to you today from the land of the Kaurna people here in the Adelaide Plains. I'm very happy to be here. I'm really excited to be able to speak to you about this important topic of open disclosure today. It's something I'm very passionate about.
That's fantastic, David. For those who are unfamiliar with open disclosure, is it a provider obligation?
Yes, it is a provider obligation. Open disclosure is explicitly referred to in the aged care rules and the quality standards, and it's consistent with the Statement of Rights. So providers must practice open disclosure as the first port of call in response to complaints, to feedback and to incidents. And they must have policies, procedures and systems to facilitate the practice of open disclosure. Open disclosure really shouldn't be an afterthought. The moment you've recognised the need to practice open disclosure, be proactive.
Yeah, that's right, David. Where did the concept of open disclosure come from? Is it relatively new to aged care?
Yeah, so it's been an obligation in aged care for 6 or 7 years now. The introduction of the Statement of Rights last year in 2025 certainly reinforces the role and the value of open disclosure to rights-based aged care, something that is extremely important. The timeline here in the slide that you can all see shows how open disclosure has evolved over the past 40 years. So the concept of open disclosure came out as early as the 1980s, when doctors and allied health professionals started talking about the importance of openness and transparency to building trust and improving care quality and safety. You can see in 2003, Australia became the first country to adopt open disclosure nationally when the Open Disclosure Standard was published. You can see in 2006, there was a national project which involved 40 hospitals in 5 states to develop policies, to initiate training and appoint open disclosure officers to bring open disclosure to life. In 2019, open disclosure became mandatory for aged care providers when the previous aged care quality standards were introduced. But even before it was mandatory, former Aged Care Commissioner and Complaints Commissioner Ray Lamb consistently championed apology as an effective mechanism to resolve complaints and set a really strong foundation for open disclosure in aged care. We can see that the concept of open disclosure has been in aged care for nearly a decade. We will continue to work with providers and with workers to ensure open disclosure is continuously practiced. Later this year, in the coming months, we plan to release simple and hands-on resources that clearly articulate the Commission's expectations and help put open disclosure into practice.
Thank you very much, David, for giving us that background. And it's very insightful to see, I think, how open disclosure has evolved over time and how it has a significant role in improving the safety and quality of aged care services. And I think it's safe to say that Australia has been a pioneer in adopting a national standardised approach to open disclosure. So from there, what's involved in open disclosure processes? What does it look like in practice?
I think it's safe to say that while no two processes are the same, effective open disclosure processes share similar features. So based on how open disclosure is described in the Aged Care Act, learnings from monitoring sector performance and best practice research, we've identified 5 key elements. Go to the next slide. There we go. They are acknowledge, apologise, find out, explain, and communicate, which if you like acronyms, you can use the acronym AFEC to help remember it, but let me walk you through the elements. So acknowledge. That's about acknowledging what went wrong and its potential and actual impact on the older person by speaking and listening to them. Apologise, obviously, it involves an apology. Apologising for what went wrong and its impact on the older person. Find out includes finding out what happened, why it happened, and how it can be prevented from happening again by gathering necessary information. Explain includes explaining what happened, why it happened in a way that the older person understands, and answering any questions the older person has. Communicate means communicating openly and respectfully throughout the process, which may include following up and updating the older person on changes that will be made to systems, to processes, and to practices to stop it from happening again. So while these elements are not intended to occur in a particular order, a quick acknowledgement is greatly valued. It shows empathy, it shows compassion, it helps people feel heard, validated, and supported right from the start. So apology in particular is central to open disclosure. It shows remorse. It assures the older person that lessons have been learned and unsafe practices will change. Research shows that a sincere apology can reduce the likelihood of complaints and legal action, and sometimes these are motivated by the need for answers and corrective actions. When no apology is offered, or when an apology feels insincere, it can intensify emotional distress and place further strain on the relationship with the older person. Delaying an apology also for too long can make it seem more performative and less genuine. So going forward, our complaints officers will be checking in with providers to support the practice of open disclosure to resolve complaints or feedback through our usual complaint handling processes.
That's a really great way to describe everything, David. Thank you very much. And I think it's great to know that the acknowledge, apologise, find out, explain and communicate processes are the elements that our staff are going to be looking for when assessing a provider's responses to complaints. So that's terrific to know. Thank you very much. Next, I'd like to bring Dr. Mandy Calloway to the screen to speak about the value of open disclosure. Dr. Mandy is the Chief Clinical Advisor at the Commission. Hi, Mandy.
Thanks, Treasure. Hello, everyone. I'm also joining you today from the land of the Kaurna people of the Adelaide Plains.
Mandy, as well as being the Chief Clinical Advisor to the Commission, you're also a practising geriatrician. From your perspective, what are the benefits of open disclosure?
Open disclosure enables a person-centred approach to safe and high-quality care. It certainly has many benefits for the older person. For example, it immediately begins to ease the feelings of anger, grief and helplessness, which people often feel when something goes wrong. It helps older people understand what happened and why it happened, which gives them a greater sense of control and safety. It provides an opportunity to share their personal experience and speak about how something affected them, which makes the person feel heard. And it puts the older person at the centre of the decision-making and continuous improvement process, which assures them that the matter will be resolved in a way that meets their needs. And all of these benefits help with reconciliation and restoring the older person's trust and confidence in the provider. For the providers, open disclosure tends to support workers to be their true self. It enables them to see the situation from the lens of the older person, including the seriousness of the situation and the physical and psychological impacts on the older person. This helps the workers to learn from it and prevent it from happening again. It also strengthens the sincerity of their apology and helps to restore the relationship with the older person. Open disclosure also cultivates an open and continuous improvement culture, which leads to long-term safety and care quality improvement. It demonstrates a commitment to act with integrity, honesty, and transparency. It provides closure for the workers, helping to alleviate feelings of guilt and shame. And lastly, it lowers the risk of legal actions and complaints. So from my personal experience, open disclosure need not be complicated. I think about it as a natural extension of compassionate care, which we know lies at the very heart of high quality and safe aged care. It need begin with nothing more than, "I'm so sorry this has happened. Are you okay?" And then following that up with, "We're going to have to look into this further to make sure it doesn't happen again." From my view, open disclosure should be just a normal part of our everyday practice, something that we do routinely, because as you said, Treasure, it's the right thing to do. But I know how busy it is working in aged care. For open disclosure to be sustainable, it's important that the workers are adequately resourced and supported to do it. It's important the provider has the right policies, processes and systems and leadership in place to make it happen.
Thank you, Mandy. I knew it had to happen once where I'd put myself on mute. I think that really enforces the practice of the value of open disclosure and how it benefits the older person and also aged care workers. I've got a question though for you. From our data, we can see open disclosure is often practiced with older people's supporters and may not always include the older person. What's your thoughts on this?
Well, generally speaking, open disclosure should be conducted with the older person directly, as soon as practical after the incident. When appropriate, a supporter can also be included in the process. The purpose of open disclosure is about ensuring the older person understands what's happened and what will be done to resolve it. It's also about preventing the same thing from happening again so that the person feels reassured that their matter is taken seriously. It's important that the affected older person is the primary participant in the open disclosure conversation, nothing about them without them.
Yeah, so what do you think then if the older person has cognitive impairment? Does that change anything?
Well, the cognitive ability of an older person actually has little relevance to undertaking open disclosure because none of the elements of open disclosure require the older person to make a decision. Instead, it is the recognition of the older person's personhood which guides our approach to open disclosure, as it should guide every interaction in aged care.
Can you expand a little bit on the concept of personhood?
So personhood means every person has value, dignity, and identity regardless of their abilities. Cognitive impairment of any cause does not take away a person's personhood or their aged care rights. Everyone in aged care, including those with cognitive impairment, have the same rights, including the right to be respected and to be safe. People with cognitive impairment experience emotions like feeling safe, comforted and cared for in the same way as people without cognitive impairment do. They are more likely than not to also experience the emotions of shame, disappointment, anger and grief when things go wrong. So open disclosure is about restoring that feeling of safety and trust in your care. So if there's been an incident or a complaint, staff should acknowledge it with the older person first, even if the older person is living with cognitive impairment.
Thank you so much, Mandy. Thinking about personhood is a great point for us to move on to our last segment today, which is the scenarios where open disclosure must be practiced. Thanks, Mandy. And now I'd like to welcome Kyle Sheldrick. As Liz mentioned, Kyle is the Assistant Commissioner for Serious Incident Response Scheme, the Provider Performance and Insights.
Thanks, Treasure.
Hi, Kyle.
Hello, everyone. I'm joining from Parramatta, the land of the Burramata people of the Darug Nation. As Treasure said, today I've prepared some scenarios to show when open disclosure must be practiced, and I will invite David to share his view on the complaint scenarios. Before we do jump into those scenarios, let's have a quick recap on what open disclosure is. So, open disclosure must be practiced when something goes wrong. This includes incidents and possible incidents, or when a complaint is made. I'll give people a moment to read this first scenario. Now, let's take a look at this scenario on the screen and figure out whether open disclosure is required. In this scenario, we can see that Deborah has made a complaint after being left in her wheelchair for an extended period, and that the same thing happened twice that week. In this scenario, open disclosure must be practiced by the service manager to resolve the complaint. How would this look in practice? Well, first, the service manager meets with Deborah to talk through what happened. They ask Deborah if she would like them to contact her family to let them know about the matter. They will acknowledge Deborah's frustration and discomfort. They will let her know that they'll speak to her care worker and other people to understand why it's happened. They will apologise to Deborah for her experience, and they will find out why Deborah was left in her wheelchair by speaking to the care worker and other staff on the same shift. For example, one reason might be that there wasn't enough staff at the time, or that there was a misunderstanding between staff about allocation of duties. The manager sits down with Deborah to explain their findings, asks if she understands or whether she has any questions. Throughout the process, the manager will communicate with Deborah about possible solutions to understand how to best resolve the matter. For example, putting more staff on the shift or clearer communication about the division of duties at the start of each shift. Once resolution has been implemented, the manager will follow up with Deborah to confirm it has not happened again. It's also important that the service provides practical supports that Deborah may need. For example, scheduling a GP or physio visit to look into the muscle cramps and lower back pain that she's mentioned. David, what will your team be looking for if they've received a complaint like this and the service did not do open disclosure?
Thanks, Kyle. I think first and foremost, our complaints officers would always be guided by what the older person wants and their rights under the Aged Care Act. So if we were to receive a complaint like this, we would first of all want to speak to Deborah. We'd want to speak to Deborah first to understand if she's spoken to the provider. If she has, we'd ask what the response was from the provider. Our officers will also check in with the provider to understand how they will address the matter using the principles of open disclosure. So we'll be guided by the principles of open disclosure and also the older person, who is the centre of all that we do.
Great. Thanks, David. That's very helpful. Let's move on to our next scenario. Once again, I'll pause for a minute here to let people read. Okay, so this scenario is quite different. In this scenario, we can see that Maria is unhappy that her monthly statement has been delayed, and she's unsure why she's being charged differently from what was agreed, and the fees have gone up. In this situation, open disclosure must once again be practiced by the provider to resolve the complaint. When Maria contacts them, our expectation would be that they listen carefully, clarify when needed, and respond respectfully to acknowledge Maria's frustration and concerns. They will apologise to Maria for her experience and let her know what the next steps are. They will find out why there has been a delay with the monthly statements and why the fees and charges are different by reviewing the monthly statements and the itemised invoices, and also by following up with the accounts team and delivery partners. The provider will contact Maria and explain the reason behind the delayed statements and the costing methodology of their unit price for each service delivered, and components that have been factored into the final price charged. The provider will communicate regularly to ensure Maria is informed. They will discuss potential solutions with Maria. The manager will follow up with Maria to understand if she's happy with how the matter was resolved. Clearly, if the provider foresees any disruption to the continuity or quality of services provided, they must communicate with Maria in a timely way to safeguard her safety and well-being. David, what do you think about this scenario?
Thanks again, Kyle. This one's a bit different. So the aged care rules provide protections for support at home participants to make sure prices are reasonable and transparent. It prohibits support at home providers from charging prices that are unreasonable and cannot be justified. So providers need to ensure that older people can understand and agree to terms and conditions in their service agreement. So this includes the fees that they're being charged and how they're being calculated and applied to their monthly statement. Providers must include agreed service prices in the older person service agreement, and they must not be charged more than the price specified in that agreement. If there are changes to the cost of a service, the provider must discuss and agree the new price with the older person and update it in that agreement. Providers must provide older people with their monthly statement no later than the first day of the following month. In this scenario, we can see that something has gone wrong. So if we were to receive a complaint from Maria, we would check in with the provider to understand how they will address the matter, including using open disclosure principles. We may ask for documentation about the open disclosure process and how the provider is meeting their pricing obligations.
Great. Now let's move on to our last scenario. Once again, we'll pause here just to give you a chance to read the scenario. So this scenario, once again, is slightly different in that we haven't received a complaint. In this scenario, we can see that Trevor, a rostering manager at the home care agency, realised that one of his workers missed their shift to attend to Lynn at her home 3 days ago. Lynette has not made a complaint about the missed visit. So does Trevor need to practice open disclosure here? Yes, open disclosure is still required. While we do not have information on the type and level of care Lynette requires, failure to provide scheduled services creates risk to her health and safety. For example, missed medication, unmet personal care needs, or falls. In some instances, depending on the foreseeable risk and impact on the older person, this may also constitute neglect. For this scenario, we would expect Trevor to contact Lynette immediately to see if she is safe and whether she requires any practical support. For example, scheduling a makeup visit on the same day. Trevor needs to ask Lynette if she would like him to contact her family to let them know about the matter. He would acknowledge and apologise for the missed visit and any physical or psychological impact on Lynette. He'll also need to explain to Lynette reasons for the missed visit and let her know what will be done to find out why the worker's contact details had been entered incorrectly. Then Trevor will need to check in or communicate with Lynette to make sure everything is going smoothly. He'll tell her about the improvements that will be done to prevent similar things from happening again. He'll ask if Lynette is happy with what he's proposed and will apologise again for the missed visit. That's our last scenario for today. Hopefully these scenarios give you a clearer picture of when open disclosure must be practiced. Remember, open disclosure must be practiced in all circumstances where an incident, possible incident, or complaint has occurred. When determining the most appropriate action, it's important to exercise good judgment and consider the unique circumstances of the case, and always consider what the older person wants and their rights. Thanks again for your time and engagement today, and I'll pass it back to Liz for our Q&A.
Thanks so much, Kyle, and to the other presenters. Really interesting set of presentations and some really useful scenarios to get our thinking going. We do have time for questions now. There's been some questions submitted both beforehand and during the session, and the Q&A function is still open. So if you want to put a question through, please do. And I'll ask various members of the panel to comment on the questions. And I'm going to start with Treasure. So the question is, can the aged care provider decide who should or who should not conduct open disclosure?
Yeah, but the person leading the communication would usually be the most senior staff member involved in the person's care. So that would be a general rule that you could apply. But providers really should be consulting with the older person first to determine the information that they're willing to share and who they're wanting it to be shared with and who they'd like to speak to. So it's really important that their privacy is protected at all times. But once the older person's preferences have been confirmed, providers can determine who the best person is to conduct the open disclosure. So it's probably quite topic dependent as well.
Great, thanks, Treasure. I might ask David this question. Do we at the Commission differentiate between initial disclosure and formal disclosure, and are there different policies and procedures required?
Thanks, Liz. It's a good question. In aged care, we don't differentiate initial disclosure and formal disclosure. As the underlying principles and elements of good open disclosure practice are the same and scalable. So when we talk about scalable, we would acknowledge that while formal disclosure may be more appropriate for some serious matters, not everyone will share the same perspective on the seriousness and the impact of the matter. So as always, we would encourage providers to speak to the older people first, speak to the older person. They are the centre of what we do. Speak to their families, carers and supporters, if that's appropriate, to really understand their needs and expectations before deciding on what to do.
Fantastic. Thank you, David. There's a question that's come in, which kind of is another stage in that question, which is that open disclosure often occurs in steps with various staff members involved. So how do providers document all the elements of open disclosure? Do they need to provide a written report to the older person or someone?
I think it goes to and is along the same lines as the last question that you asked there, Liz, is formal versus initial. Are the steps all required? They are all required in principle, but not in order. And it would really depend on the circumstances of the actual case, seriousness of the matter, and also the person's preferences. Like we say, when we're putting the older person front of mind, they may want a written explanation, and that may form part of that open disclosure process to restore that relationship. So it's dependent on many things, but I think if you're guided by the individual, the older person at the centre of the matter, I think you'd be on the right track.
Thank you. I might ask Kyle the next question. Is open disclosure an expected response for all incidents or only reportable incidents? And is it different for incidents than complaints?
Okay. So dealing with the first part first, registered providers have to manage all the incidents that occur in their service by using an open disclosure process. This doesn't differentiate between reportable incidents and non-reportable incidents. Reportable incidents, though, and evidence of open disclosure for those incidents have to be lodged as SIRS notifications with the Commission, whereas non-reportable incidents obviously don't. In terms of whether it's conducted the same way for incidents and complaints, the answer is yes and no. So open disclosure should be conducted the same way between incidents, possible incidents and complaints, in the sense that you follow the same elements, that AFEC acronym that David walked us through earlier. You still document it in the appropriate system at your service. So for instance, incidents and possible incidents should be documented in the incident management system, and reportable ones lodged with the SIRS notification, and complaints should be documented in the complaints management system. However, open disclosure should also be tailored to the details of the incident or complaint. This shouldn't be a cookie cutter or tokenistic process. It needs to be genuinely directed to the experiences of the older person at that time. So in that sense, every instance of open disclosure will be a little bit different.
Thanks, Kyle. I might ask Mandy this question, which is, how would you manage an open disclosure meeting where there's complicated family relationships, such as estranged family members or step family who do not speak to each other or don't want to be in the same room?
Well, the first thing to consider is what's the preferences of the older person? Who would they like to involve in the conversation? You know, in principle, it is best to have everyone in the room to hear the same information. But if the older person would like to involve family members that may have strained relationships, then the provider will need to take appropriate steps to mitigate safety or privacy concerns. So, for example, you may consider using a suitably secured tele platform to get everyone in the room virtually, or perhaps less ideally, multiple meetings may be required to make sure that family members with strained relationships aren't in the same room at the same time. Very often, open disclosure will require more than one meeting to fully resolve in any case. But clear and detailed documentation to alternatively try and keep everyone on the same page will also be important when there are complicated family relationships.
Thanks so much, Mandy. Got a really interesting question by Dennis, from Dennis. I might ask this one to Treasure, but it's about how do we as a commission assess the quality of people's open disclosure practice, and particularly in the context of a diverse workforce, a high turnover environment. What are the kind of system level controls that we might be looking at, that we're expecting providers to have embedded so they know that open disclosure is being delivered consistently and it's person-centred and it's being undertaken by relevant workers?
That's a really detailed question. I'll do my best. The very first thing, from a complaints perspective, the way that we would see whether open disclosure has been practiced effectively would be in our conversations with the complainant and the older person, who may be different, about whether open disclosure has met that person's needs. Because it isn't, and I think David said this, and I think Kyle said this as well, it's not just a one size fits all. So very first off, in a complaint setting, does the person feel that they've been acknowledged? Have they had all their questions answered? And are they satisfied with the actions that the provider is going to take moving forward to ensure that the issues don't occur again, be it for that person or for people, more generally. If it's something that can be something that's maybe more systemic in the environment. And of course, what we're looking for is whether that person feels that they've received a genuine apology, and that they feel that there was some sincerity behind that. So again, we're very much, the effectiveness of open disclosure and our evaluation of its success is going to be very dependent on the response that we get from the older person. Of course, in the serious incident and reporting scheme, when we want to know that you have practiced open disclosure. We may not necessarily be talking to the individual affected. We might not be, it depends. So we may not have a chance to ask them if they haven't also lodged a complaint. But nevertheless, we want to make sure that it is appropriately documented and that you can point to circumstances that ensure us that you have applied open disclosure and the principles that we have suggested are being used.
Thanks, Treasure. I mean, I think it is a very complex question. I think I'd also add, when we're undertaking an audit or something like that, we will be looking at the policies, the practices. We do interview staff, we do interview older people, so we'll be trying to garner whether they've got an understanding, does the staff have an understanding about the obligations around open disclosure, but also older people, how they feel matters are handled. But we will also be interested in the board's view and whether the board understands open disclosure and the commitment and the obligation for open disclosure. So, but yes, it's a very, very good question, and it's not a straightforward answer, but thank you. I've got another question here from Wendy, which I might ask David. And this is something that happens quite a lot with us. Sometimes the complaint comes from the older person's family member and their observation of the care and services. So what's the obligation to disclose to the older person in that circumstance?
Well, as has been mentioned in the presentation, we always take the approach of nothing about you without you. So we would engage with the older person to hear their perspective. And we're often dealing with other parties in complaint matters, representatives, family members. It's important for us to engage with all the parties that might be relevant to a person's care environment. So we would look at what's been provided to us by that representative, by the family member. We would speak to the older person, then we would speak to the provider as well. And sometimes there is something's lost along the way, lost in translation. There are many sides to a story. As we know, we unpick a lot of information through the complaints process. So we would put all that information in the mix, engage with the older person to see what's lacking. Is there something lacking for us to explore further? Is there an unmet need for the older person, or is the need lying on the family member's side of things? Do they need more information about the situation to support the older person? There may be complicating elements with that, but we would apply the framework that we talked about, the affect framework, to see if the elements of open disclosure have occurred, and if something has not really hit the mark for the older person and their representatives, we might ask the provider to explore that further.
Thanks very much. I might ask Mandy the next question, which is around when the older person has limited decision-making capacity. And I think we've all been involved in examples where the older person doesn't want to involve another supporter. So how do we balance their right to person-centred communication and the duty of care of providers?
Well, I guess as mentioned previously, the open disclosure approach is not reliant upon the older person having decision-making capacity, and nor is it reliant upon the presence of supporters. And as such, I would expect open disclosure to essentially proceed without necessarily compromising the provider's duty of care. But what would more likely compromise the provider's duty of care would be to simply accept the older person's request for privacy without asking more questions. So when an older person, any older person with or without cognitive impairment, makes the decision which is unexpected or unhelpful or unsafe, we should be asking why. And I would be interested to know firstly why the older person declined to involve their supporters, as there may be a very good reason. Has the older person been provided with enough information about the open disclosure process to be able to judge what is best for them? And has there, in fact, alternatively been a misunderstanding? And of course, there are degrees of involvement which might lead the provider to find a much more helpful compromise. So in most cases of open disclosure, there would usually be little risk to the older person if supporters were not involved, and as such, the provider should feel comfortable honouring the older person's preference for privacy. But if open disclosure was expected to lead to wider reaching conversations and important decisions being made about ongoing concerns or risks, then a more supported way forward would need to be negotiated.
Thanks so much, Mandy. I might ask Treasure the next question, which is what specific guidance is available to support providers and workers to give an apology that helps restore the relationship?
Yeah, we have an open disclosure framework which provides specific guidance on how to word a sincere apology, and I'll underline sincere. But I also want to reiterate that an apology is not considered an admission of fault or liability, and it's not considered in determining fault or liability. All Australian states and territories do have enacted apology laws designed to protect apologies, so you can look a bit more into that in your relevant state or territory. But the long story short is that an apology should include the words "I am sorry" or "we are sorry." And when apologising for something that's happened, it really shouldn't include speculative statements, admissions of liabilities, or any kind of apportioning of blame.
Thanks so much, Treasure.
Thanks, Liz.
I might ask David this next question, and it's a situation I think many of us have experienced, which if the patient or the family are still unhappy post an open disclosure and continue to ask questions, how do you manage the situation so it doesn't continue to be an ongoing issue for a long time with lots of back and forth?
Yeah, it's a really good question, and this is something that happens from time to time, and we are often involved in those sorts of scenarios. Goes back to the original framework, looking at open disclosure, provider obligations, and has the provider taken those reasonable steps to understand the individual's needs, to provide the information that's required? Have they done all that they can that is reasonable in the circumstances? One of the things that we achieve through our complaints process, the most common outcome we achieve through the complaints process here at the Commission, is a better explanation. So we're finding that we often fill a gap that might not have been able to be provided through an open disclosure process or through a complaint process directly with the provider. Or it might be having a bit of distance and having another party involved in the process that can help a person understand the situation and get that information in a way that makes sense to them. So from our perspective, we would be looking to see, has the provider taken reasonable steps? Have they met the essential needs of the individual? And if more information is required, we might ask the provider to take another look, do a bit more. If we're of the view that they've done a reasonable job here and unfortunately more information is not available, or it's going to repeat what's already happened, we might say the actions of the provider here are entirely reasonable in the circumstances and there's not further value in us engaging. That may be the point. Often there's a gap, and it's through understanding the individual and the individual's needs that we can usually identify that. So I'd encourage providers to look at their situation, work with the individual. What is the need that hasn't been met from the other party's perspective? And just have a good look at that. Have we taken reasonable steps to address that? If you have, then that's good. If not, it gives you another opportunity to have a go at that.
Thank you, David. I've got a question which is, I'm not sure whether it's David or Treasure or Kyle, and I'll ask it, and one of you maybe could have a little bit of a go, which is about the overlap between open disclosure and whistleblower disclosures. So whistleblower disclosures, particularly where the person's identity is not available. So we do get quite a lot of whistleblower disclosures, and we get anonymous complaints as well. So how would we handle if something came to us through such a disclosure? How would we handle the kind of open disclosure requirements? Who wants to have a go? Kyle, you said you're willing to have a go, so over you go.
Yeah. So in any care setting, including aged care, it's not unusual that when there's a failing or a perceived failing or something goes wrong, that it triggers more than one process. And we see this in tertiary healthcare in hospitals. We see this in residential aged care facilities as well. And it might well be that something triggers multiple obligations. So if something goes wrong with a patient's care, with a resident's care or a recipient's care in home care, it's not out of the realms of possibility that a carer or someone else might look at that and say, this is a serious systemic failing that needs to be disclosed in some way. That doesn't take away from the need for open disclosure as well. So it's very common when something goes really badly wrong, that you might have open disclosure and a root cause analysis. The fact that there are other processes going on doesn't really impact whether open disclosure is required or not. It might well be that someone looks at a failing and they think this triggers multiple different reporting obligations. They may see something and say, that's also a mandatory notification because it involves someone who's an APRA registered clinician. Despite all of that, if it is something that has gone wrong, if it's an incident or a possible incident or a complaint, you still have to practice open disclosure. And part of the reason for that is understanding what open disclosure is, why we do it, and how it fits into the broader scheme. Open disclosure is a restorative way that we contribute to people having their rights respected in aged care. They have an entitlement to understand what has gone wrong in their care, and that's not changed by whether somebody else is investigating it or whether there's some other process on foot as well. So what I would say is it's the only way to discharge your responsibility to practice open disclosure is to practice open disclosure. There's no substitutes for it, and the fact that another process is engaged doesn't change that obligation.
Thanks so much, Kyle. That's a great answer. And we do, as a commission, often find we are managing a particular incident or set of incidents through multiple parts of our work as well. It might be coming through a serious incident report. It might be subject of complaints. It might also be something we're undertaking an active inspection of a facility as a result of it. We may even be in a compliance and enforcement sort of space, but I think that's really good to remember. None of that means that you should pause or stop the open disclosure process. Jane has asked, what are the penalties, implications for a care provider failing to comply with these requirements of open disclosure? We don't have anyone here from our kind of compliance enforcement side, but what I would say is that it's an obligation of the provider. Like all the obligations, our goal is to see that the provider is undertaking a process of continuous improvement. So if the provider isn't undertaking open disclosure, our first step would be to understand why, help them access resources and training, and hopefully we would see some improvement. The penalties implications would come a long way down the track if we felt the provider was not genuine about providing open disclosure. Is that right, Treasure? Do you want to comment on that?
Thanks, Liz. I think you've pretty much got it. One of the things about open disclosure and the importance of it is that it really demonstrates the culture of the provider and the organisation and the services that are being delivered. So that's perhaps not strictly something that you might see spoken of in the Act, but it is. But it gives us that overarching view. The culture of the organisation is such an important part of our overarching view on a provider's willingness to improve as well, when we're looking at, the whole, the provider as a whole. So I would say what we're really hoping for is that open disclosure gives us a window into the posture of the provider and how willing they are to learn and do better when perhaps they haven't been able to meet their obligations. I don't think we're going to necessarily come after anyone with the pitchfork, but we are going to expect that if we see repeated instances where a provider isn't demonstrating open disclosure, then it may give rise to other processes that we use. So I do think it's definitely linked to that positive approach to willingness to do better and willingness to provide better care or better services.
Thanks, Treasure. And I'd just say we as a Commission also hold ourselves to that standard, and we make mistakes and we try and practice the culture of open disclosure and apologise to older people or their supporters, or to providers where we've got it wrong or we've not taken sufficient care. So, but yes, I think it's what we're really looking for is the attitude of commitment and compassion. There's another question here, which I think is from Andy, which is that family members sometimes have issues understanding why do they need to include the older person in a discussion about open disclosure, and particularly when the older person has cognitive impairment, and they often want to protect the older person from feeling pressured or being confused in the discussion. So how can providers and staff manage those kinds of situations?
I mean, it can be quite tricky to walk that line. And I've certainly had families say to me, why are you talking to, their mother? Because she doesn't know what's going on. But I think the premise is the way in which we engage with older people should always be in acknowledgement of their personhood, because they may very well know them. They may not be able to verbalise it, if you like, but it's more often than not, they would know when something's gone wrong, when they've been hurt. And I think we have to err on the side of considering our duty of care is towards the older person and not necessarily to their family or their family's concerns. That being said, family are a really good source of information about the older person, and they may be able to judge, what, the sorts of things that might upset the older person. So I wouldn't suggest that you completely ignore the older person's supporters or their family. It's walking that fine line. But I think the principle essentially is still, at the end of the day, the open disclosure should occur with the older person first, gently, sensitively, compassionately, through these aged care staff who know that older person well. That's, I think that's probably the premise for most circumstances. You won't get into trouble with that necessarily.
Thanks so much, Mandy. We've only got a few minutes left. I'll go for one more question, which is for Treasurer, I think, which is about have we produced guidance documents and where can people find them? And there's people are particularly interested in the case studies. They thought they were quite good learning tools and they'd like to use them with their staff. So I'll throw to you.
Yes, I think so. I think they're really good too. Next week, I believe all the magic will happen. We will be sending a follow-up email to our attendees today and all those who registered with links to open disclosure materials, and that should get you started. But I think it's an ongoing piece of work for the Commission, so we will be continuing to provide guidance over the coming months. Thanks, Liz.
Fantastic. Thank you, Treasurer. All right. Well, I might close the session then. I hope it's provided you a refreshed understanding of the value and importance of open disclosure, and with a clear message that when things go wrong, it's best to practice open disclosure because it's the right thing to do, not only for the recipients of aged care and their loved ones and supporters, but for yourselves and for your staff and for your services. We will be publishing a recording of this session online, and we'll send you a link. And as Treasurer said, we'll also send a link to our resources on open disclosure in the next couple of days. Thank you so much again to our panellists, Treasurer David Kyle and Dr. Mandy Callery, with their incredible level of expertise and experience on open disclosure. And until next time, thanks so much for joining us today. Bye-bye, everyone.